First disease condition apnea of prematurity. Definition: apnea may be defined as a cessation of respiratory respiration for 20 seconds with or without cyanosis. It is common problem in preterm neonate. It occurs in preterm neonates between 2 and to 5th day of life due to immaturity of developing brain. Types: according to the etiology, apnea is of three types: central apnea, obstructive apnea, and third one is that mixed type. Central apnea, it's occur because of pathophysiological causes like sepsis, metabolic problem, hypoglycemia, hypocalcemia, temperature instability, respiratory disease, anemia, and polycythemia. Obstructive apnea, it's occurred due to blockage of airway due to secretion, improper position like hyperflexed, neck or hyper hyperextended neck or baby. Mixed type episode of apnea prematurity may start as either obstructive or central, but then involve elements of both and because of mixed in nature. Apnea can be classified into following two categories: primary apnea and secondary. Primary apnea, when an infant is deprived of oxygen, an initial brief period of rapid breathing occur. If the asphyxia continue, the respiratory movement ceases, the heart rate begins to fall, neuromuscular tone gradually diminished, and infant enter a period of apnea known as a primary apnea. Secondary apnea, if after primary apnea asphyxia continue, the infant develops a deep gasping respiration, the heart rate continue to fall, blood pressures also falls, and infant becomes nearly flaccid. The respiration becomes weaker and weaker until the infant takes a last gasp and enter the period of secondary apnea. Incidence of apnea of prematurity occurs in at least 85% of infants who are born before 34 weeks of gestation. Physiology: respiratory efforts are primarily depends on response to increased level of carbon dioxide and lactic acid in a blood. A secondary stimulation is hypoxia. Response to this stimuli is impaired in a premature infant due to underdevelopment of respiratory center of brain, thereby leading to apnea. Management: drugs like aminophylline, theophylline, caffeine, and doxaprem are used to treat apnea of prematurity. Supportive measures including monitoring in hospital. The preterm should be monitored for respiratory movement, heart rate, and oxygen saturation. Respiratory supports raising the infant's level of alertness by simple tactile stimulations. By touching the skin or petting the infant may stop an apneic episode. Increase environmental oxygen level by placing the infant in oxygen hood with supplemental oxygen can reduce the frequency of apnea. Continuous positive airway pressures CPAP is sometimes used for apnea when medications and supplemental oxygen are not sufficient.